big day yesterday. Saw lots of announcements. It was nice to see good things happening for ResearchHub. Very excited about the DMT Quest studies. Some of them already live, and I checked them out. Amazing stuff there.
Yeah, it's really cool. It was a pretty announcement packed day yesterday with the kind of launch of the V2, which I'm sure we'll get into today, and everyone here in the audience can hear a little bit more about it. And then some of the $1 million commitment from DMT Quest is really cool to fund. I think there's going to be close to about 10 projects that they're looking to fund, about 100K each. And then, some of them are live, a lot more to, go live still too. But stuff, anything around like fentanyl addiction, breath work, a bunch of variety of things. So it's going to be really cool.
Yeah, nice. I'm going to try to speak from my personal account. I feel like that's a more personal note to the conversation. Can you hear me here too?
Yeah, sounds great.
Perfect. Then we can go do it like that. Yeah, we're waiting for, maybe we give it 1 more minute and then we just kick it off without him, or can you maybe confirm with me if he's gonna be here soon?
Yeah, I'll shoot a message over right now. But we can probably get started in like a minute or so.
Okay, great.
Yeah, Johnny, maybe we can just get started right now.
Yeah, let's do it. Let's just go and kick the conversation off, and then if he comes in and joins, that's amazing. And if not, we can just continue like that. So let's go. So this community call is basically dedicated, as the title says, to go into the new update and kind of discuss the ResearchHub 2.0, as I would like to call it. It's a major upgrade to empower the researchers and community. Joining me here in this conversation is Jeffrey Curry, the president of the ResearchHub Foundation. And together we'll break down what's new, why it matters, and maybe answer some questions from you guys in the audience. That's basically the introduction here. So maybe to kind of start off the space, what was the driving vision behind the ResearchHub 2.0 redesign, Jeff?
Yeah, and I'll probably be speaking a little bit for Pat here, as well as Kobe, who is the lead developer. But I think this is a lot of people who are I think in the kind of starting their own company space or building their own product space kind of understand this, but a lot of people on the consumer side or the user base side don't really see this, because they often work with products that are kind of already closer to a really terminal, well-structured state. But when you're first starting a product, there's a lot of things that you try to get out there quick, and it's not arced in the best way, or updates happen over the years, and you need to kind of update into the more kind of progressive modern versions of the things. So one of the impetuses for this was, and there's a term I recently heard called founder's code, which is when you start, developing a product, you kind of have code that's there that gets something going and going live, just to see if you'll get traction with users. And then once you start getting traction with users, then the next step is to kind of gut out the code and re-architect it with much more kind of modern and progressive and things like that. So one of the reasons was to kind of restructure the code base such that we can essentially code about an order of magnitude faster with different developments or fixing any bugs or glitches. Whereas in the old app, it took quite a bit of time to do this just because of the way that the app was structured and organized. So that was one way. And then the other thing was, in the old app we had, and again, this is kind of vestigial to the fact that, when you're starting kind of a product, you need to find out what sticks with users. So by nature and virtue of that, we had a lot of different features in the original. So there were things across a lab notebook and a reference manager, and things were really there was a lot going on. And that was one of the big feedbacks we'd gotten from our user base. There's a lot going on here. So another big part of this was to sunset some things that weren't getting as much traction and help consolidate things into a much simpler UI and UX. And so we hope that is kind of the case in the new version. You can see on the left sidebar some of the kind of more simplified versions of everything. And then, also took the time to reformat a bunch of the features, like the comment editor, the bounty system, and especially the funding feature.
So if I understand correctly, it's kind of the main impetus is really to take something that was basically fast coded to get traction and take that and make a solid product out of it that is more, as you would say, solidified, or better suited to scale in a sense.
Yeah, absolutely. And so I think this will probably be able to kind of handle and manage a lot of kind of order of magnitude increase in user base. And we've already been getting quite a bit, especially high quality reviewers who are flooding in. Different little things that were difficult to patch up. So yeah, very much so.
The modernization, of course, is the other aspect there, where you can use AI to continuously upgrade the software with the latest best practices in coding, I guess. So that being said, let's go a little bit more into the details. And maybe before we dive into all the details structurally, I would be curious, what are you personally most excited about now that ResearchHub 2.0 is live?
So I'm particularly more excited about the one. It seems small, but the comment editor, and I think anyone who's used the old app is really excited about having a new comment editor. It's much more modernized. It can do a lot of like more modern functions. It's just a lot, yeah, easier to use. That connects the dots well with the bounties that are opened, so you can actually like award direct instead of having to do some like workarounds with tips. And then the other big one really is, I think, the crux of what we're going to talk about here and what a lot of researchers are excited, which is like crowdfunding on ResearchHub through what are called pre-registrations, which is a term most people don't know about. You can think of it just like a public proposal. It's like a public grant proposal, but you outline like all the methodology and like kind of statistics that you're going to use for the study that you're proposing. And we have a crowdfunding feature around that works a ton more smoothly. So I'm really, really, really excited about that aspect.
Yeah, I resonate with these two that you just mentioned, especially the funding feature is very exciting. Later in the space, we're going to go a little bit deeper into that because there was another announcement right around this feature and how it's being used right now by DMT Quest. So let's dive into a little bit into the different updates that have been happening. So let's talk about the first, like, most visible update. When you go into the new app, you see that it has a new UI and a new user experience. So what has changed there? Can you maybe take us through this and tell us a bit how the look and feel has changed and how maybe some of the user feedback that you have forwarded to the team has been integrated there?
Yeah, so just off the bat, I mean, anyone can go here right now. So if you go on researchhub.com, you'll find that like this is kind of the original app where everything's been housed, originally. And then if you go to new.researchhub.com, you'll find the new application. So you can go and like juxtapose it for yourself while you're there. And yeah, so what you'll notice like off the bat is a couple things. One is a much, much, much more simplified left sidebar. So instead of having 7 or 8 items, we boiled that down to like 4 or 5. That's consolidated a few things. That would be kind of one thing off the bat on the homepage. The other one is you'll notice like a little kind of gear icon on the right. So you're actually able to now like follow different topics and different journals. So this helps you kind of self-curate a following feed for yourself. So you can, similar to like any social media app like TikTok or something like that, you can have a For You style page or a trending page, as well as like a following page, and then also a latest page of just like in real time things that are flowing into ResearchHub. So just, on the home screen, those are some like big changes that you'll see off the bat. Another one, which is feedback we get a lot around, is like the idea of research coin and like kind of what is it, and like it's hard to get it onboarded and offboarded. So to people here that might not know, research coin is like the digital asset that's used on the platform, and it was really hard for users to like figure out how to get access to it, how to like convert it to US dollar if that's what they wanted. So in the research coin page, there's a little icon next to your profile. It'll take you to a page. That page has been redesigned. There's like a kind of more embedded wallet connect. You can sign up for wallets within there, as well as swap and deposit and withdraw a lot easier. So I think that one's another exciting update that's a lot more apparent. And then, yeah, just simplified kind of like crowdfunding. And I guess the other big one you'll notice too is doing a lot more for like social proof and like attribution. So now there's like a leaderboard. You can go see who are the top peer reviewers for the week, who are the top funders. We want to give like a lot of social kind of credit and proof to some of the people that are really putting in a lot of the work to either peer review, and they're doing high quality reviews. So we want to spotlight them, as well as like top funders who are going and donating to these projects in the funding tab.
All right. So I'm hearing many things here. So a new sidebar, simplified sidebar, a different. Oh my God, I can't put them all together. Can you maybe bullet point them for me once again?
Yeah. So simplified left sidebar, we've got the research coin page. So the My Research page, I would recommend people check this out if you like were having, issues with research coin before. Then have the ability to like follow. You can follow different topics, or you can follow different journals. This allows you to have like a following tab. So you'll have like the latest, following, and then trending as well too. So yeah, so those would probably be some of the highlights.
Yeah, and I think then there was the customized feed that you named, so you can customize your own content, and I think that sort of covers it. Luckily this is recorded, so I can listen back and figure out what else is new. And I think with that being said, there's one feature that I have here in my notes, which is the improved search. So can we talk about search and how to find articles on ResearchHub, or how to add articles to ResearchHub that haven't that are not there yet?
Yeah, absolutely. And I think this is one openness to for the like audience at some point to give feedback, whether if you're here right now or if you're listening later. So the search has been much improved. So you can go search for kind of people, authors, journals, topics, all of those things kind of auto-populate and drop down in the search bar. I believe some of them have like a follow button right next to them. So within the search bar, when you're looking for it, you can actually click follow. And again, that'll help curate like your feed. So that would be one thing. And then if this is, I think, one that's a little bit more contentious with people, where if you want to upload a paper or if you want to go search for a paper, very interestingly, we used to have a flow where there's a button that says share a paper, you type in the DOI, and then you can get it uploaded to the platform. Well, in the new app, if you just search for a paper, we should have indexed like almost every paper that's out there. And what'll happen is if it's not on ResearchHub yet, when you go to do the search, it'll actually upload behind the scenes the paper in real time into ResearchHub and then kind of give you the usual UI of a paper that you'd see on the platform. And it'll do that all behind the scenes. So there's actually no place for you to click share a paper, but simply by searching the paper, it will share it on the back end. And it should only take about a second or two for that to happen. So to the user, it should feel fairly seamless, as if like the paper was there the entire time.
Nice. So basically there's a native experience of like having all the papers at your fingertips anyway. So you don't have to upload them, so to say, you just have to find them. And then they are going to be there readable for you.
Yeah, exactly. And I think like and this is a little bit, I think it seems easier and much more fluid, but also like a little bit less intuitive. I've had already one or two people ask like, oh, where can I, share or upload a paper? And so this is kind of the point of contention, which is it too simplified where people don't know that they can go and like find the paper? Are they looking for a share a paper, section that they would prefer? Or is that something that just because it existed in the old app, people are accustomed to it, but new, fresh people probably wouldn't be requesting that? So I'd be curious to hear people's feedback specifically on that subject.
Yeah, that's a very good point. Definitely contentious. I have also heard that like some confused users there, mostly though they were old, like they were used to the old app. Okay, then let's move on to the funding feature. So I think that one is, like you said, is one of the most exciting updates. So what is new with the new funding feature? And yeah, let's just start there before I add anything to this question. So what's new?
Yeah, so one of the things that we've been doing behind the scenes more is a little bit of like, call it like white glove service, where we've been having conversations with the various, donors as well as researchers. We have a lot of, I don't think there's a shortage of researchers who would say, hey, we're looking for money and we're happy to put a proposal up to get some money. So there's always a kind of a lot of interest on that side, but it's always the other side of like the donors and funders who have the money and they want to get it to the right people. So we've been doing a lot of that behind the scenes, starting to chat with some of these donors and funders, and we have kind of a very, very deliberate outreach effort going on right now over the last couple of weeks. So I'm excited to see where that goes. But we have, and we announced this yesterday, a commitment for $1 million from a nonprofit called DMT Quest. They fund a lot of work around like psychedelics research, as well as like things around like breathwork and consciousness and things of that nature. But fairly rigorous kind of content. And I think that's one of the big things that the funding feature employs is like the ability for peer reviews to happen at the level of like the proposal or the pre-registration. So you can think of this as like a grant is submitted and it's kind of a public grant, and we kind of leverage our peer review marketplace on ResearchHub to be able to peer review these things out in the public. And you can, this is, one thing that's exciting to me for the funding feature, because people here that might be familiar with like the NIH process, usually you submit a proposal. It's about 80 or 90 pages, of a bunch of content, which is really laborious, takes a couple of months just to simply write it, versus our pre-registrations, which take, they're just a handful of pages. So that's already off the bat, something that's saving the researchers a bunch of time. But also in the kind of studies in the NIH model, you have these things called study sections. Study sections are, they get some expert researchers to look over your proposal and say, hey, does this score well to get funding or does it? And the big problem with that is happening behind the scenes. You don't know what these people are saying. You don't know who the people are. You don't know if those people have a vendetta against you. You don't know if they're best friends with you, so they're just going to give you the money. So with ResearchHub, when you have the peer reviews out in the public, then all the accountability is there. So I think it's great for both like the person who's, making the claims and the people who are receiving the money, because the accountability is there both sides. So that's one thing that I think is particularly exciting. And then again, going back to much more on like the social proof side of things, which is as a funder, you'll be able to kind of have your like name and image kind of put up there in like a leaderboard style would be the second one. And the last one that I think is very important for the donors and funders is actually working with a partner. We're going to kind of make a more formal announcement, but their name is Endowment, spelled Endowment with a DAO in the middle. And they're actually helping us give tax deductions to people who donate. So one of the kind of issues we had come across for the last few months was, we have users and who want to donate some research coin. This money is going to researchers often at universities, and these universities all have nonprofits affiliated with them. So if you donated the research coin, there needed to be a system to swap that into US dollars and for the US dollars to make it to the university for the researcher to do their work. Well, we didn't have kind of a third party that was helping us here. So the money would have to go straight to the researcher. The taxes would get really confusing. And then the donors wouldn't get tax exempt for any of that. So now with, I can't, give them enough of a shout out. Endowment has been wonderful in allowing donors to donate the research coin. They'll get a kind of a tax receipt in return that they can use for like kind of tax deductions. So great for the donors to continue to fund these things. And they help on the back end with like the swapping to the US dollars and then sending it into the nonprofit affiliated with the university. So we're currently doing this right now with Stanford. And we've done this in the past too with universities like Harvard as well as Purdue. So we're really starting to, I think, touch on some of the big universities with these funding features.
Okay, amazing. So it's basically a faster way, a more transparent way where you can get the peer review upfront, and you also have the tax exemption. So that sort of sums it up as a feature.
Yeah, exactly. So getting like the tax exemptions as the donor and then getting the money to the researchers really, really quickly are two of the big ones. And then I think like the social proof side of things is also very important. I think people want recognition, some kind of recognition for either the funding that they offer or the peer reviews that they've done, to help the research improve, or as the author, like you want credit for like having received, this thing that people decided was worthy to be funded.
Can you put some color on what does quickly mean here? Like what is the traditional timeline and what is the timeline with this new feature?
Yeah, so the traditional timeline varies quite a bit. I can speak for myself. When I was in my PhD program, I received an NIH grant. It was like a F31, so this is like a pre-doctoral fellowship. So this took about 9 months total. So this was about 3 months, 2 to 3 months to simply kind of write the whole document. It was total of something close to 70 pages. And then another like 3 or 4 months for the NIH to grab like the right people to get them in a room together to like sit and read the proposal and then give it a score. And then another maybe about 3 months for them to actually distribute the money to the university. So that amounted to about a total of 9 months. And I'd say that's like relatively standard and or quick for the traditional system. You hear oftentimes a year and a half for people to get the money from the time they've written the proposal. So that's kind of what you're working with on like the traditional side of things. On the ResearchHub side of things, when we say quick, we're talking more on the scale of like weeks. So we've had people come in, so the proposals are much more abbreviated. So they're more like 3 to 5 pages or so. They've just got the core information in there. So it takes the researcher a ton less time to write it. So, say a week, they'll often have a lot of these ideas and concepts already written down somewhere. So about a week. And then crowdfunding is open for 30 days. We often get these funded a lot quicker. So for example, this recent study at Stanford, it was kind of studying the neural circuits that are involved in like the reward system for opioid addiction. So funded in about 2 weeks. And then it'll kind of go through our third-party partner, Endowment, and land into the university's nonprofit. And that process takes, they told us, about a handful of days. So we're looking like a week to draft the proposal, another couple weeks to get it funded, and then another handful of days to get the research coin converted into a fiat currency for it to land into the researcher's account at the university. So all in all, under a month.
Okay, so from 9 months you can shorten it to like a month. That's pretty quick. So then I connected to this feature. We also have this big announcement that DMT Quest is basically funding research to the tune of $1 million through ResearchHub. And the first few proposals are already live on new.researchhub/fund. And I would like to know from you, Jeff, what are we expecting there? What can we expect there? What kind of research is DMT Quest funding?
I mean, it looks like DMT Quest is here in the audience, so I think we should pull them up here.
Oh, wow.
Yeah, and here
Yeah, let's invite them as a speaker. That's amazing. I didn't see that.
yeah, hear from the horse's mouth here. But yeah, we're really excited to be working with DMT Quest. They're kind of like our first big funder here. And I can kind of prime the pump here. So a lot of this type of research is a little bit underappreciated in the traditional realm. It took a psychedelics research like quite a bit of time for various kind of bureaucratic and political reasons, quite time to gain some traction in terms of just researchers receiving funding for this work. So, I know, for example, my wife actually works in psychedelics research, working on like psilocybin and treatments for drug addiction and things like that. And, it's only now really starting to get kind of appreciated and hot in the like realm of the traditional academic space. But there's a lot of more kind of different concepts, breathwork and consciousness and things like that, that are very, very underappreciated still. And as long as there's scientific rigor and basis to the work, then I think it should be very much kind of pursued. So I'm really excited to hear, from DMT Quest, and we very much appreciate some of the kind of work and the initial here DMT Quest has with ResearchHub.
Can everybody hear me? I'm at the airport, so there might be some background noise. But yeah, so the focus of DMT Quest has been on endogenous DMT research. It's an underfunded field. The NIH hasn't funded research specifically into endogenous psychedelics for many decades, probably since the 1960s. So just my journey in terms of having a lot of discourse with scientists in the space. They've been wanting to do research in this field, but
Looks like DMT Quest just got cut off, Jeff. Can you still hear them?
No, I can't hear them anymore.
Okay, but yeah, I guess there's lots of excitement from scientists as we can hear, but there's no funding from like the big government agencies. There we are back again.
Can you hear me?
Yeah, we hear you now.
Okay. Yeah, so I was just talking about the fact that there's going to be a lot of endogenous DMT research as well as human potential research regarding altered states of consciousness, things like breathwork, trance states, and just really exploring what altered states have to offer in terms of therapeutic value as well as unmasking maybe dormant human.
Okay, so kind of difficult to hear your DMT Quest and in your background. So I think we're gonna just like try to take this over from here and keep the noise to a little bit of a minimum. So what I'm hearing is endogenous DMT research, but also human potential, as DMT Quest just called it, so breathwork and other kinds of research. One thing that I saw and found pretty exciting was like a rigorous study of what was called energy healing. So practices like Reiki or Qigong and other forms of healing that apparently some practitioners practice, and they are testing if this can help with pain relief and some chronic pain. I don't know how to pronounce this, so I'm going to just say a chronic pain condition. And I thought that was pretty interesting because it kind of falls really outside the scope of like classical materialist science and just tests hypotheses that really disagrees with like classical methods, I would say. So see what comes out of it. Yeah. So in my mind, it's important that we fund research into these domains and let the evidence speak and not just let the current model decide before we have done the research.
Yeah, and one thing too, Johnny, if I can add, which is I think like a lot of these topics are a little bit more on the pragmatic side, where they're not, hey, let's study like the nucleus accumbens and study like this subtype of neuron, which is a little bit hard for like, a lot of people to grasp. These are a little bit more closer to the like pragmatic, related to the actual like kind of patient or person. So I think they're a lot more digestible for people. So I think on that side, it's really great. And I think that some of these more kind of like interesting concepts like this energy one you were talking about, I think that one thing that people often, at least in the more traditional academic space, I think they kind of like turn off or like shut down when they hear these concepts because they think that it's just kind of casual, or people don't really do much research around it. And I think one important part here is like we can help bring kind of the rigor of what a science is it should be rigorous, and it should have like a bunch of controls, and we should be able to like make the claims given like the evidence that's there. We could that rigor can be there with these studies, and it's the perfect kind of in between, because you bring the rigor to the studies so that there can't be any questions on the result will be the result. And if there's all the controls along the way, then, that's going to be what the result is. And if the result is kind of shows in favor of these things being kind of beneficial and positive for various things like mental health or something like that, then you can't deny it as a scientist because the proof is in the pudding. So I find it to be really exciting here, because these are like topics I think sometimes people kind of like shy away from or shun, but you can't do that once the evidence is there in a very rigorous fashion.
Yeah, exactly. That's exactly what I find exciting here. It's like the stuff that we kind of shy away from because it's unfamiliar and it basically goes against what we have been seeing before. And so yeah, it's interesting that this now, like ResearchHub and DMT Quest together are kind of making these studies possible. And I'm really, really curious for the results. So like I talked about the energy healing. I mentioned like Reiki and Qigong, which are like Eastern practices. And I think breathwork also is like, goes back to like, not goes back to, but it's also very common in like practices like yoga. So it feels to me a little bit like we are bringing the scientific method with these studies to some of the traditions that have been developed in other parts of the world, where they actually put a lot of effort into developing like yoga or developing qigong. And so I'm curious to see if we study it with our methods, if we'll actually find that it works, or if we find that it won't work. Yeah, so I'm very excited for the results. Is there anything else we should add here? Maybe DMT Quest?
I mean, if the audio works all right for DMT Quest over there, I'd love to like maybe get your perspective on, I guess, what inspired you particularly about ResearchHub. You know, kind of why go through ResearchHub to get some of the work done here? Because I think from our side too, we have a pretty excited community that's happy to also crowdfund alongside some funders as well too. So yeah, curious to hear your perspective. And then I think Johnny, I see DMT Quest as a listener now, so maybe if we can bring him back up, unless I'm seeing it wrong.
For me, DMT Quest is still listed as a speaker. So I can maybe uninvite and re-invite, or I'll just invite to co-host, which is a sort of a promotion. Let's see if that works. Yeah. Meanwhile, I think DMT Quest just lost the connection. So let's wait for him to come back. And then I think another interesting topic is this, like the pre-registration feature. So we have the topic of pre-registration itself. So you mentioned, Jeff, that it kind of makes it easier to fill in, it's faster, and it puts the scrutiny of the study kind of at the front, so you can peer review the pre-registration. Can we talk a little bit about what pre-registration means and how it works?
Yeah, so, admittedly, I had actually never heard the term pre-registration while I was going through any of like my academic work. And it was only until I kind of made it across the PhD where I actually heard about pre-registrations. It's a lot more of a common thing in the social sciences, and it's a similar kind of concept and topic to actually what happens with trials with registered reports. So you usually have to kind of like register your essentially your game plan up front. So I think like a pre-registration on ResearchHub, we've kind of forced it to be a much more abbreviated version of a giant grant proposal, but they're not particularly restricted to being these kind of more abbreviated forms. So I don't think it's kind of by nature that because it's a pre-registration, it's a lot quicker or shorter or faster. But really the intention of a pre-registration is to outline kind of the parameters of the study you want to propose up front, including the methodology, including the like details of the statistics you want to do, and it holds you accountable to kind of follow those details moving forward for the study. Now, it makes a lot of sense for things like clinical trials, right? Like you don't want to start changing up your parameters or how you're doing statistics or, along the way, because this is kind of a giant funded clinical trial. But that same concept and energy is not kind of passed along through to like basic sciences research or anything like that, or preclinical work. So that's the intention of these pre-registrations. They're kind of a proven way to be more reproducible, to make the research more reproducible. So I think that's like important. One drawback of it is also like it kind of it keeps a lot of guardrails up around the studies. So part of research is also having flexibility to like kind of pivot when needed, and having things be discoverable as they come along. So that's one of like the drawbacks, but you can always kind of identify on the public pre-registration if you ever need to kind of pivot or change course, and there's like just more public attribution and transparency to the decisions that are done for the study. So I think that's like one of the kind of strengths and a weakness here of the pre-registrations, but we think ultimately it's a better way. We don't think, we know it is a proven better way to improve reproducibility in science.
I think the last point really sums it up there. Is like it has been proven to improve reproducibility, and I think that's really important, because if a study can't be reproduced, then it can't really be added to the scientific canon, because how can it be a law if it changes all the time? It must be reproduced. It must have the same result upon product like replication. Yeah. Then I think one feature that we haven't talked about so far is the journal. So ResearchHub recently launched a journal. I think in this new app, it also got a remake. So what's new with the journal, Jeff?
Yeah, I can certainly get us started here, and I do see DMT Quest in the audience again, so maybe.
Yeah, I tried.
But while Johnny is doing that, so yeah, we launched the Research Hub journal at the beginning of the year here. We're starting to like pick up steam there. We have one publication that's made it kind of across the board. We have, I believe, or so that are in review currently at some stage. And in the new web app, this thing has gotten formatted to be, a lot clearer on what's in review versus what's published. So there's a lot more transparency there with a lot more information along the sidebar. And then there's a completely kind of updated publishing flow for if you're going to submit a preprint or kind of a native Research Hub journal article. So there's like a brand new pipeline and flow for that. So that should smooth out the process a ton more. So we're really excited because for the journal, we actually, I think what we're known for mostly, which is our peer review marketplace. So, we put up an incentive for reviewers to come in and peer review work. This helps, one, give money to reviewers who obviously deserve to get paid for the work they do. But two, it helps expedite the peer review process. So people who submit into the Research Hub journal, you get an incentivized peer review. So up to 2 peer reviewers will get paid. And that expedites kind of the process and journey for your submission. So you can get across the hurdle of like, if you go submit to traditional academic journal, takes a long time to find peer reviewers, to source them, to get the peer reviews done. It's like pulling teeth. Over here, we'll make sure that process is a ton quick. We just simply incentivize our reviewers. So I think the journal is really exciting and we're getting close. One of the biggest kind of hurdles there has been getting indexed in some of the kind of the most basic venues. We need to meet a minimum of 10 publications to get there. So, currently we're in the process. I think we have about 7 total that are either in review. So if anyone out there has any types of papers that are anywhere from like original research to case studies to review papers, even negative data or contradictory data that you just have sitting in your desk drawer in lab and you're not going to do anything with it, we want to facilitate kind of the publishing and kind of visibility of that kind of work as well too. So very, very much are open. And if you're interested in any of that, please, you can, reach out to me or reach out to Malik here, who's in the audience. You can follow him here on Twitter and shoot him a message as well too.
Okay, great. So I think we went over most of the features. There's probably some features there that we haven't talked about because a lot has been changed. But I think it's a good time to raise audience members to the speaker podium and let them ask their questions. So if anybody wants, you can request the mic and ask some questions here if you want. Meanwhile, Jeff, let's sum up the journal feed. What changed there? So you spoke a lot and I'm trying to figure out what is the major change here. I think one thing that comes to mind is that when you first in the journal, you can now distinguish between what is in review and what is published. And that was previously not possible.
Yeah, that would be kind of the most straightforward UI change, is just kind of discerning what's in review, what's completed and published. And then the other one is like an improved flow during the publication process. So that's kind of a lot more refined. So if you are trying to publish, it should be a lot simpler to go ahead and do that.
All right. I don't really see many audience members request the speaker podium. So I think there's no questions here in the audience. If you have anything, maybe react with an emoji and I'll just invite you.
Yeah, if anyone has any questions, so this could be anything around like the change in UI, UX for like ResearchCoin, how that's done, for the funding. If you're kind of interested in learning more about the funding, feel free to ask some question now, like the process of getting it crowdfunded, some of the experience some of our other researchers have had. I'm very happy to answer that as well too. And then also, Johnny, I don't know if you've already requested for DMT Quest to come up, but I would really love to give him the floor here to talk about kind of his experience and the impetus for why he wanted to kind of work with ResearchHub on this.
100% would love to have him explain his motivation there, but I can't get him up to speaker. I've extended multiple invitations, but somehow either the space is not working or his connection is not working. I don't know, but I can't get him up here on stage.
Yeah, he expressed he was at the airport, so I think it might be a little bit of a tough situation. So yeah,
so I think with that being said, like, we probably could end the conversation here. Do you have any last words, Jeff?
No, I would just really, really, really highly encourage everyone to take a look. So the new web is at new.researchhub.com. So it's going to be there for a period of time. And then once kind of all the little bugs have been ironed out, then it'll flip over into just regular researchhub.com once we feel like it's in a good place. Though, for anybody here in the audience, please, we have one hand up and a shaking hand. So I think we might have something from Rena. But while we get Rena up here, yeah, so just take it for a spin, see how you like it. If there's problems or bugs or something like that, there's a support button on the left sidebar. You can always open a support ticket and just kind of give us that feedback. You can hop Discord, also just give us that feedback. There's a bug reports channel in the Discord. That would be immensely helpful. And if you're interested in like crowdfunding, you can certainly kind of come and have a conversation with me. You can shoot me a message here on Twitter or X, or if you're interested in publishing into the ResearchHub journal, we're a few publications shy of like getting across like some of those kind of core indexing venues, which is going to unlock a ton more people to come to ResearchHub. So that would be immensely helpful for us too. And if you're interested in that, then please shoot a message over to Malik Donda here in the audience.
Great. Rena, welcome on stage. What is your question?
Do you hear me?
Yeah, we hear you.
Thank you for the conversation. And I didn't go to the website. I wasn't on a ResearchHub, but I do it recently, and I'm do it right now, actually. And I look onto the topics where you choose topics like medicine, AI, art, and I'm curious why you didn't mention space science, like aerospace. For example, you have broad engineering and what else? Physics, but also you have like neuroscience, more narrow fields. And I think you should add a space. I think it would be really grateful.
Yeah, that's a good question. So our initial kind of community over the last couple of years has like naturally kind of nucleated around this idea of like biomedical sciences. We do have like some work in like engineering, some people from physics, but certainly getting kind of like an aerospace one added there. That is a kind of new flow, is having these like topics that you can select from.
Yeah, it's sorry for interrupting you. I'm interested, for example, in space medicine. I work in space medicine, and I think today it's multidisciplinary fields that cover many fields of studies, and I think it should be supported as well.
Yeah, absolutely. We will love to, and I'll pass that along to our developers to include it there. There's also like subtopics that are kind of tags on multiple different papers. Those ones are a lot more granular and nuanced. So it's very possible that we have the right tag there, just not during that like kind of topic selection. So I'll pass that along. The kind of PhD program I was in actually had a grant from NASA to do some like work on like the microbiome in space. So I definitely resonate with this idea of like space medicine and biology.
Rena, I just checked, and I think if you put space in the search bar, you can actually see a few results there that you might want to follow.
Oh, thank you. I will check this.
Yeah, we got DMT Quest up here. So DMT Quest, would you be willing to tell us your motivation to like work with ResearchHub in your funding endeavor?
Yeah, sure. Can you guys hear me now?
Yes, we hear you.
Okay, great. Yeah, so one of my main motivations is because the peer review system has too many issues in terms of the speed of publishing science. I think that this is a major issue, a major bottleneck for the entire industry. For example, right now, I have somebody that has finished his research regarding endogenous DMT. He submitted it last year and is still in peer review. So we're going to be looking at something like a year and a half before it actually gets published. And it's ridiculous because it halts, the speed of science, and speed is the currency of today in terms of getting things published. So I saw that ResearchHub is really working on the situation regarding the amount of time needed for peer review, the transparency of it all. So I think that's very important, getting the cryptocurrency community involved and funding really cutting edge science that moves the needle and has big impact on society. I think that's another thing that drew me to this space as well.
Yeah, that's amazing. Like we also feel like the peer review process is just kind of it, I think of like the pipes of scientific kind of information distribution, and peer review is like a kind of important, limiter that's there, right? It's like a big filter that's supposed to be there. And it's just the least kind of like incentivized thing in all of science, I feel. And so I think just simply incentivizing it helps push registrations and proposals across faster. It helps push the end publication along faster. And so we're super happy to like be pushing the peer review process on these early proposals. So yeah, I appreciate you saying that, DMT Quest, because we feel like the peer review is going to be the big kind of game changer in this whole process.
Yeah, absolutely. It's going to help get more funding in. The quicker that there's a turnaround, I think that the funders are going to get more excited about funding science, because it is today, a lot of funders go ahead and fund the science, and it takes 2-3 years, and people have kind of moved on in terms of their excitement on the project. So I think that the faster turnaround is really going to spur a completely new way of funding these programs.
Yeah, and just to note, we've got actually bounties on all of the kind of fun projects, the proposals that are out right now. So if you want to actually follow along in real time, which you can't do in like the way this is traditionally done, if you want to follow along in real time publicly, you can just go ahead to the Fun tab in the new website, and then just go to the different projects, take a look at the peer reviews tab, and see if any peer reviews load in over the next couple weeks. Usually our average time is about 10 days, so over the next few days, and follow along.
Awesome. Well, thanks so much for having me, guys. I think that there's going to be a lot more groups contributing to ResearchHub, probably starting later on in the year and next year. It's really exciting. Everybody I talk to wants to get involved in terms of funding, from the funding perspective. So yeah, stay tuned. I think there's going to be a lot of real intriguing projects that are going to be game changers as well.
Yeah, thanks for bootstrapping this whole thing with us, DMT. It's been a pleasure.
Yeah, for sure. I love working with you guys and looking forward to working with you guys for many more years. I got to hop on a plane now, but it was great talking to you guys.
Thanks for sharing your perspective, even in this traveling circumstance. So yeah, great to have you here. Maybe we can host another space where we get you as a main guest, maybe with some of the funded projects, and we dive deeper on your mission and how ResearchHub is supporting it. Great. That being said, I feel like we finished everything in this space. Jeff, another time, do you have any last words? The last words this time?
No, beyond what we've already talked about, just head to the new website. You can, if you go to the old website, researchhub.com, there'll be a banner to take you to the new one. So feel free to go there first and then go to the new one, or just go to new.researchhub.com and just go test, mess around with it, see what you like, see what you don't like, and please just give us feedback. That's the biggest part of it. So more kind of all hands on deck in tuning the website and changing it and improving it over the next few weeks here. So yeah, please just give us a ton of feedback. And a big one, if you're really interested in getting funding, you can go post a pre-registration. You can come, preferably talk to either kind of, me, or just message me here on Twitter. If you're interested in the ResearchHub journal and getting us, the next few publications would be amazing. Again, any kind of more biomedical sciences type work is appreciated there. That would be really great. If you're interested in that, please message Malik here in the audience as well too.
All right. Thank you, Jeff, for hosting this with me and giving us all the insights. And thank you, audience, for listening. And I'll see you on the next X Space or community call here. Great. Have a good rest of your day, everybody, and see you next time.
Bye, everyone.
Bye.